2 doctor's appointments in one day? Susan, are you crazy? Yes, friends, I have 2 doctor's appointments. One's just a follow-up, ortho, right knee replacement, 1-year follow-up. And the other, sadly, is another stimulator trial for my spine. This is the second time. Been already through this once. Yeah. Got my chill pill. Yeah, the nerve stimulator trial is done in the doctor's office with the representatives of the nerve spine hardware company. In my case, it happens to be Boston Scientific. This is not sponsored. This is my life, and my insurance is paying for it, so I'm grateful for the opportunity to try to find relief for my spine pain. But I've been through this once before, 5 months ago. It was not very successful. It was a different doctor, and he tried to advance the wires. He was able to get it up one side, but I guess they go up the sides of your spine, inside the bone, to put the wires so that they can contact with, and then there's electrical signal sent, and the actual 2 days I had it in my spine was very helpful, but he was only able to get it up one side. So they didn't consider that successful, so they wanted to, my neurosurgeon wanted it redone. So I've been referred to another doctor. I've seen him a couple times. And 3:30 this afternoon. I'll keep you up to date. The hardest part is I can't stretch out. I can't bend. I can't lift more than 5 or 10 pounds. I'll have the straight on that. And I can't shower. I can bird bath. I can't shampoo my hair. So I might be contacting my hairdresser or going to one of the local little chop shops and paying to get a shampoo. I cannot go a week without shampooing my hair. I'll be a mad, crazy person. I can go a couple days, but not a week. And that's my day, guys. Simple orthopedic appointment. Yeah, I'll probably be there an hour and a half, 2 hours. A very busy office. Very good doctors. Very busy. Yeah, all us retirees are getting bone joint replacements. Yeah, and then 3 o'clock I take my chill pill. My husband's driving me there. He's driving me home. And I'm gonna have this big block. It's the trial battery. It's external for the trial. And then I get an app where I do how I'm feeling. And last time Boston Scientific guys called me several times. Guys, ladies. And if it's successful, then they'll schedule in a surgery center to have it permanent placed. And then the battery is implanted, kind of like, if you know anything about pacemakers, the battery is implanted under the tissue. Well, they insert the wires and then they implant so it's not a real painful procedure, I hope. I say I hope because I'm hoping to have enough deep sedation so I don't know what's going on during the permanent. We'll find out, won't we? Because we're going to go on this journey together. You want to come? You don't. But if you're interested because you or a family member have a painful back, maybe this is something you want. And this is something I found I had to bring. I've had several patients over the years that have had nerve stimulators, and I would say 9 out of 10 were happy. The feller that wasn't happy, yeah, he decided to clean out his storage unit kind of immediately after he had the permanent put in, and you have to limit your movements for 4 to 6 weeks so that it sort of scars up in place and doesn't migrate and move out of the target zones that it was placed. Yeah, no, you have to listen and don't move. Do the limitations that they tell you. So anyway, that's what we're doing today. Rock modern medical. So I'll see you later. I might attach a film just before my procedure and after my procedure, if I'm lucid enough after my chill pills to do that. Hopefully no family secrets given out. But anyway, see you later. Bye. Good news, everybody. My knee has healed perfectly. Doctor liked the x-rays and said it looks perfect. He was impressed with the motion, flexibility I had with it. And I don't have to visit my ortho doc anymore. Knee? Ortho knee? Yeah, the only thing is I do have to take antibiotics for 2 years anytime I have dental work. But other than that, no more contact. One doctor knocked off my list. Yeah, that's a good thing when you're my age. Usually you're adding doctors, but I got one less. Yeah. Anyway. So this is my little belt that I have on. This is my temporary battery. And these are the cords that go back to my back. And I've plugged into the wires that go up my spine. I thought I'd show you the temporary battery, wires, and remote that are I have on me during my trials, nerve spine stimulator trial. That's the battery and this little black belt. This is the remote. And when you have a permanent, you do have a remote. You can like turn it off, turn it up. Yeah, it was set for me by the gentleman, Boston Scientific. But that's what it looks like when you're having a trial stimulator. Bye. So it's the day, 7 days with this temporary belt thing, and I was calling him Blinky because he blinks. And yeah, gonna get 2 foot by 1 foot tape removed off my back today, and gonna have the wires pulled. Then we're gonna discuss with doctor. It's really helped. I would say my pain is, my personal experience, my pain is 70% better. I have other discomforts because I haven't been able to reach, stretch, twist my waist. So I'm kind of stiff. My muscles are all kind of stiffened up. But otherwise, I'm doing very well. So hopefully we'll be discussing a permanent implantation. And then I don't get to move, stretch, reach, twist for 6 weeks instead of 1 week. So let's go find out. Let's go find out and get results. Hi, everybody. So yesterday I had my wires removed from my trial nerve stimulator, and it's wonderful. to be able to lift my arms. We are working on moving forward with the permanent, and that takes probably about 2 weeks for insurance approval. I have to see my primary doctor, which I'm seeing my primary doctor anyway next week. There's been labs, chest x-ray, EKG ordered, and so I'll have to get those done. So we're aiming for the first or second week of December, and if he's not able to get a block time at the surgery center, then we're going to work towards the first or second week of January. I will again be limited to my movements, but this time 4 to 6 weeks. Yeah, they want the wires that are inserted. These would be surgically inserted, and they want time for them to sort of like scar up into place so that they don't migrate. And yeah, it's tough not being able to lift your arms, reach above, reach. Try it for a couple hours where you just not bending over. Yeah, that's the tough part of it, but you know, if it can give me some lasting, better pain control, my back is all messed up, then it's worth it. Yes, now that I'm out of movement restrictions, I went to Costco, so yeah, that's the update, that's the plan. I just gotta move forward, try to get my pre-op stuff done, and wait for approval, and hopefully scheduling a procedure either first or second week of December or first or second week of January. Yeah. Anyway, have a great day. Thanks.